I want to just say welcome to everyone. I'm Diana with Bothell Pediatric and Hand Therapy, and today's presentation is coming from our hand clinic. And I want to welcome you here. I do want to let everyone know we are recording this meeting, this webinar, and then we'll send. We're not going to put it on YouTube. It's going to be, well, if we do, it'll be a private video. It won't be a public video, but we will send out the recording for anyone, the links if anyone wants to rewatch it afterwards for further information. And we do welcome you here. Thanks for coming. So tonight's presentation is working pain-free while at home during a pandemic. And our presenter tonight is going to be Akim Nirmoy. He is our clinical director at the Hand Clinic. And so while he's presenting, well, I think we can leave the cameras on because he's going to be doing a screen share with a PowerPoint. And then we can come back, and if there's questions towards the end, happy to answer those. So I will hand it off to you, Akim.
Well, just wanted to say welcome, and I'm glad that everybody's here and interested in the topic. It's a very important and personal one to me. And, obviously in the middle of a pandemic, a lot more people are working from home, and it's really good to understand how we can all work from home better, especially since it may be a little bit longer than we may all want to. So I'm going to go ahead and start the presentation now. Like Diana said, if you have any questions, please reach out in the chat or save them for the end. Okay. Today's presentation is working pain-free while at home during a pandemic, presented to you by Bothell Pediatric and Hand Therapy, the Hand Clinic. Like Diana said, my name is Akim Nirmoy. I'm the clinical director at the Hand Clinic, and I'm also an OT specializing in hand therapy. Today's agenda, we'll be talking about working from home and what that looks like, understanding pain, common injuries, what can you do, and what's next. I'll tell you a little bit about me. I recently moved to Washington State about a year ago from Kentucky. Originally was born in or grew up in Houston and moved to Hawaii to Oregon, Oregon to Indiana, and to Kentucky, and now here. And so I've traveled and worked in a lot of different places and worked in a lot of different setups. So I have a good understanding of all the crazy setups that people could have at home. My background is an undergrad in exercise science with emphasis on biomechanics, studying the human mechanics and how it works and is connected. I did a lot of research towards that and went to grad school at Spalding University in Kentucky for occupational therapy. And I practiced for a small period of time in pediatrics, working with kids birth to 21. And currently, as I said earlier, I'm the clinic director at Bothell Pediatric and Hand Therapy, the Hand Clinic. So the big question is, what does working from home look like? For most of us, this is what working from home looks like. Whether you have kids or don't, these are all the positions that we've been in, I've been in. They are comfortably uncomfortable. And that's the hard part to reconcile is how do we know what is the right position? And it's important to note that working from home, is trying to manage what you have and make the best of it. And so today, hopefully I'll be able to provide you with some key information here. And just to, of note in all of these pictures, this is just trying to make it work for the time and not really taking consideration the duration. And with the duration that many of us are going to be working from home, we now have to transition from these comfortable setups because they definitely don't support us long term into a sustainable work position, whether it's sitting, standing, or some alternatives. This is one of my favorite quotes. Chronic pain is a manifestation of imbalance, typically physical, but also mental, emotional, and spiritual. A lot of times we get focused on pain just being one thing, it's physical. But there's a lot, especially for people working in these strange times. We have to take in consideration that you can be pain in multiple ways, and stress, whether it's mental, emotional, or spiritual, can contribute to some of the physical pain that you're having. It can exacerbate it. And sometimes being able to use that mental, emotional, spiritual can help overcome pain. So this is one that you definitely want to take in consideration when looking and examining your pain, is not just assuming that it's just a physical pain. So I'll talk briefly about types of pain. There's two main types of pain: nociceptive pain and neuropathic pain. Nociceptive pain is your pain that involves external input, meaning that contact to tissue or repetitive stress and strain, or it is acute. And can become repetitive. Neuropathic pain is more internal, where you're dealing with nerve pain or issues with organs that stem from the brain and spine. So pain that does not need necessarily external output to manifest. Other type of pain is generally thinking of like fibromyalgia, chronic pain syndrome, things that don't have a necessary source and research hasn't discovered where it comes from. You're thinking more long-term chronic conditions that usually are diagnosis by elimination. And that's where they are taking you through, medication, physical therapy, or occupational therapy, and seeing what can and will help you. And then if none of the therapies, none of the interventions or surgeries, then you get the diagnosis by elimination. That's what we categorize as other pain. And here's just kind of a better way to look at it. Nociceptive pain is traumatic, it's repetitive stress, and arthritis falls into that category as well. Nociceptive pain, pain rising from tissue damage, and neuropathic pain and also other pain can connect. And if you look at the Venn diagram, the easiest way to look at this is, how they can be connected, and even including other pain. So you can have all three of these. Having all three of these is not a fun place to be, but you can have repetitive strain from working from home. You can have neuropathic pain from impingement of a nerve, and you can also have a condition like fibromyalgia. And just to go in depth on neuropathic pain, again, it can also arise from a traumatic injury, repetitive stress, neurological and neuromuscular disorder, metabolic disease, chronic infection, cancer, or it can be genetic. I typically like to educate people and patients on understanding how to identify which and where they are in this Venn diagram. And sometimes you could be seen for therapy, make progress, and then all of a sudden plateau. And you might be dealing with a secondary type of pain or even a tertiary. So I always like to help people understand, how to understand what pain and how to describe it, and help the therapist uncover some more in-depth dysfunction. So the most common type of pain that we deal with from working from home is repetitive stress. It's an umbrella term referring to different musculoskeletal and nervous system disorders that are caused by repetitive tasks, forceful exertions, vibrations, mechanical compression, sustained or awkward positions. When you look at that first slide, you have a pretty good understanding of the potential for mechanical compression, and sustained and or awkward positions. And that typically in the realm of work injuries is what you're dealing with. And adding the repetitive task is where you begin to create the environment for pain in certain areas. So just a quick, and this is just a quick slide. I won't go in depth. You can kind of see the numbers there, but this is what the numbers say. You look at the amount of people that take time off work for their repetitive stress injuries. The striking one is 1 in every 50 workers has RSI symptoms, and that's just reported. So with many conditions, this number is higher, but these are just the recorded cases. We've all been in situations where we have pain, but we don't report it. We don't acknowledge it. And below you can see the most common points of pain of all RSIs. Wrists is 69%, fingers is 29, forearms 23, and thumbs 20. So that's a lot of distal symptoms. And that's typically where you're dealing with improper positioning and compression. And I'm going to give you a brief overview of the most common. These are top 5 or top 4 common repetitive stress injuries. Most of you have either experienced one of these or even multiple. These are not mutually exclusive. You can actually have all 3 or all 4 of these at the same time. The most common one is carpal tunnel syndrome. It's an entrapment neuropathy, meaning it is pinching of the median nerve. Symptoms are related to compression of the median nerve, results in pain, numbness, and tingling in the hand. Key things to note are this being a neuropathic pain is you don't need necessarily a external factor for the symptoms to be present. It can be completely internal, meaning arising within the body or being from compression inside the body, from just positioning. And when you look at the key things, it's numbness and tingling in the hand. And we'll kind of dig deeper into what that means and what that looks like. Cubital tunnel syndrome is impingement of the ulnar nerve. It's constant direct pressure or stretching or intense strain. Symptoms include pain, tingling, numbness, and weakness in the pinky or small finger and ring finger and hand and forearm. So when you look at the common connectors here for this, it's entrapment or compression or pinching, and this is all positional. And so when you're looking at how to identify, whether you have symptoms of either carpal tunnel or cubital, you're exclusively looking for the numbness, tingling, or radiating pain, sometimes pain that you can't palpate, touch, or manipulate. The third one we'll look at is Dequervain's tenosynovitis. This is known as texting thumb. It's an overuse injury, typically involving the thumb. Very common these days. We're all on our phones and we're all being connected to the internet. A lot of us, while working from home, use our phone for a lot of things, whether it's a distraction, whether we're making calls or playing games. Either one of those can contribute to an increase in thumb use. It is a painful inflammation of the 2 thumb tendons that are involved with flexing the wrist and extending the wrist. Pain typically worsens when the thumbs or fingers are moved, the wrist is turned, and then trying to grasp something. So grasping your phone and turning or moving. The fourth one is tendinitis. And in the picture, you'll see detailed golfer's elbow and tennis elbow. Tennis elbow is the outside and golfer's is the inside. We are typically looking at inflammation of fibrous cord which attaches to the muscle or bone. It occurs around the shoulders, elbows, wrists, knees, and heels. So this can be anywhere where you're having irritation and inflammation and or adding repetitive motions and certain mechanics. For people working at desks and at working on computers or even phones, This is something that just gets irritated and starts getting worse over time. For a lot of patients that we see, the underlying conditions and inflammation of the sheath are there, and it takes an event like gardening on the weekend, and everything was fine, and I was getting the garden ready for summer, and the next day it was really sore, it was inflamed, and then it was hard to work. Or, you know, we got an unusual amount of snow and you're shoveling in the driveway, and all of a sudden you have increased pain. A lot of times the cause is work, but something external, like working in the yard or working around the house, triggers a lot of these conditions. And that's the important thing to note is it's not if it arises, if you ever get cubicle tunnel or carpal tunnel, any of these symptoms for these conditions, it's important to recognize that it may not actually be an acute. Typically, these are chronic or gradual over time, and an event is just kind of the last straw type situation. And so we're going to dig a little deeper into understanding pain. A lot of times this is the part where it makes diagnosing hard. It's understanding what contributes to repetitive stress and what the difference between palpable pain and referred pain are. In this situation, we're going to look at referred pain. It is pain perceived at a location other than the site of painful stimulus or origin. It is the result of a network of interconnecting sensory nerves that supplies many different tissues. So when you look at these two examples I have here, a common source of entrapment for people working in the office involves the muscle on the left, the scalene muscles. And if you look at that pain pattern, those are all the areas that you may experience pain, which typically can mimic tennis elbow, outside of the elbow and into the forearm. It could mimic some upper back pain. And so it often can make diagnosing certain conditions hard because you can completely eliminate one symptom and still have these other symptoms. And so referred pain, the goal is trying to understand where the source is, whether it's compression at the neck or compression and tightness of the muscles pinching a nerve. And the other one is a muscle called supraspinatus, which is one of the most often torn rotator cuff muscles. It helps to lift the shoulder if you're thinking of a snow angel. And if you look at this referral pattern, it's very similar to the other muscle, the scalene, and it presents as
Which
tennis
picture
elbow.
is that, Kim? Is that the bottom left or the
Yeah,
bottom right
so
picture?
it is this picture here.
Thank you.
So this is the second condition, but this is the muscle for making a snow angel, lifting your arms out to the side. And a lot of times we see this along with some of these other conditions, whether it's tennis elbow or carpal tunnel. So it's really important for anybody working from home to really be mindful of pain and understanding, can you touch it? If you can touch it, it is not referred pain, but it can be under referred pain, meaning that if that makes sense, if you can have multiple symptoms over each other and clear one and still have symptoms in the same area. And so oftentimes people have had surgeries to improve carpal tunnel syndrome and still have positive signs of carpal tunnel. So let's move on here. All right. So what can you do? There are three types of ways to deal with types of repetitive stress injuries: conservative, therapy, and surgery. Conservative treatment typically involves resting, icing, bandaging, and non-steroid anti-inflammatories or NSAIDs. Usually the doctor, if you go seek treatment, looks to move with conservative treatment. Or if you're at home, this is the easiest way to start. Icing, heating, or just being off of it. If that doesn't work typically, your next step, if you see the doctor, is to be referred to therapy to try to avoid any progression of the symptoms. So looking at therapy, depending on the source of the injury, because not all repetitive stress injuries are upper extremity. Sometimes people have symptoms down to lower extremity. So occupational therapy or hand therapy, which is us, and physical therapy if there's some lower extremity and some spinal concerns and issues there. So here at Bothell Pediatric and Hand Therapy Hand Clinic, our focus is, working one-on-one with patients to really attune to your needs and injuries, and understanding what that injury is and how we can help you. We're one-on-one focused. We do a lot of diagnostic treatment, trying to understand and get to the meat of the issues, and looking beyond the immediate, oh, it's easy, it's carpal tunnel, that's a diagnosis, but trying to identify where the source of the pain or problem is, if it's not just, a carpal tunnel injury. And that's where therapy comes in handy. I always recommend to people, regardless of whether you think you need it, go get it checked out. It's the simplest, easiest thing to do to determine whether you need to be seen. And sometimes it's good to ask questions and be able to ask somebody who sees a lot of these injuries, what can I do? And even if you decide against going to treatment, it's important to have somebody to answer your questions that's in that environment all the time. Doctors oftentimes, they are best at surgeries and injections and doing more medical model interventions. And sometimes there's so much that's needed to determine how to fix a repetitive stress injury that they just simply don't have the time, especially in this environment. So therapy is an important approach. Between manual therapy and neuromuscular reeducation, helping you learn how to move your body and position it in a more efficient way to decrease stress and strain in certain areas, which also includes ergonomic assessments. The third, for some people, it's surgery. Sometimes if you've overlooked an injury or ignored it for too long, your only path to success is surgery. And even in that situation, I always recommend going in and asking for referral to hand therapy or physical therapy, because sometimes it may appear that there is no other recourse, but having somebody take a second look at it to see how we can help you, even if it's getting prepared for surgery and ramping up and getting you stronger, getting things loose. It's an important avenue to explore before a surgical intervention. And surgery typically involves release of tension, release of compression, and then typically a referral back to therapy. And we're on the other side of things, helping you get stronger, helping you understand how to avoid putting these pressures. And so surgery isn't necessarily a bad thing if the pain is so bad that it is impacting how you live and how you engage in regular everyday activities. So that's where there's a little bit of a misconception that sometimes surgery is a bad thing. It's only bad if you don't need it, but if you need it, absolutely have that conversation with the doctor. Let's move on here. So 3 keys: posture, positioning, and mechanics. Those are the 3 important things for trying to avoid being in a situation where you need to come see us or the doctor. And a lot of times the internet is full of useful information that can help people accomplish these things. However, the internet is a very scary place. So I will give you a couple of direct tools to understand posture, positioning, and mechanics. And the first one is a simple ergonomic calculator or ergonomic tool that takes your height into consideration and gives you a full workup of what you need to do, to which you all should see on the screen now. Please let me know if you don't. So this is just the easiest and most simple, straightforward website that I always recommend to people assessing their ergonomics at home. So for example, I am 5'11", and so I will click the 5'11", and it'll tell me my height in inches, and it'll give me the recommendations for a sit desk as well as a stand-up desk. The important things to note, excuse me, on when looking at this information is it looks like you need to purchase a new desk, looks like you need to purchase a new chair, it looks like you need to purchase a new monitor, mounting system. However, there's multiple ways to adjust and address these things. The important thing, especially for short people, is to understand that, you know, this positioning, the L's, is not a reality because oftentimes your legs are off of the table or hanging off of the chair. So modifications, adding a stool to get you at that 90 degrees. For people working on monitors that you can attach to the wall, adding books to accomplish the height necessary to not strain and overuse the neck. Stand-up desks are also another area where you can accomplish this with a pew, putting it on top of a desk. You can build a box to put on your desk to achieve these heights. So if your desk is here, you're thinking of splitting the difference to get you to the height necessary. And so this is a cost-saving way if your company is not going to allow the purchase of a full stand-up desk. Another thing to think about is comfort. Having a shock pad. You can typically get these to help distribute the strain of standing. Oftentimes I recommend a box here to allow you to rest one leg while standing on the other. But this is a quick and easy calculator that I recommend. I will put it in the chat so you all can access it and put in your height and kind of get some measurements. And it allows you to print a PDF file that has all of this for you to take or fax or email to your company if they need this information, if you are still working in the office. But working from home, this is just a good, simple way. There's no frills, there's nothing to worry about. It is just, what's my height? And here are the measurements. And that's the first recommended site. The second recommended site I have and recommend is the United States Department of Labor website. This is a great and simple way to checklist for purchasing equipment. And I'll actually share a better one that we can dig into. Understanding where and how you're positioned. This is just a self checklist. We use a version of this for checking and evaluating during ergonomic assessments with patients. Just to quickly touch on, some of this information here, it addresses the head and neck, and asking yourself. And again, this is where you have to be honest with yourself about, are you genuinely in these positions? I typically have people take pictures of themselves or have a friend, spouse, or set up a selfie, a timer to take a picture of yourself to understand how you're positioned. If you have somebody that can take a picture of you so you can answer these questions without you knowing that they're taking the picture, that's the best. Because typically you are at your best when you're getting ready to take a picture. You know, you're here all day long, and then somebody's going to take a picture of you, and you're upright and working and at all the right angles. So have somebody take a picture of you so you can answer these questions genuinely on how you're positioned. It's like, oh, actually, I am slouched over, or I am reaching to the right, or I am leaning to the left, or my feet are dangling, or my keyboard's too high, or my desk is too high. But just, this is a quick and simple, easy evaluation tool. Addresses all the way down to the feet and legs. Seating, keyboard, device, and I think Diana's put that in the chat window for everybody to click on those links. But this is, and we won't go into too much detail about this, but I just want to leave that there for people to have a quick and easy tool to get those dimensions in, and then have an assessment of that they can tangibly address whether they're meeting their needs, ergonomic needs at home. All right, so this is a more in-depth look at workstation design. This is almost, most of the population is not here. I fight to be here, and it fades. But this is exactly the optimum work position for most of us and where we should be. And looking at this person, there's not a lot of high-tech equipment. There's not a specialized desk other than that it lifts and raises. And that's really it. The monitor is slightly adjustable. So, you know, workstation design, you have to understand that good posture is hard work. It takes constant reminder because we've always lived at a point where we think I'm doing it right. And then when you take a second, it looks like, oh, no, I'm not doing it right. And now it's time to undo that. So, you know, good posture, you have to think about it until it becomes a habit. And you have to ask yourself, you know, am I willing to put in the work? Because it's definitely something that will help save medical bills, time off work, and also stress on your life, because we all want to get to retirement and enjoy it and not be run down. So be mindful about it. You know, really think about, you know, I feel like I'm concentrating. I'm leaning into this screen and the monitor, and and sometimes when we get sucked into the screen and monitor, we're in these positions where we're hyper focused and the world around us disappears. So be really mindful, and try to, you know, really focus in on those things that you need to fix and adjust to get you in a comfortable place where you're at the end of the workday, you're not flopping on the floor, you know, and we're trying to recover from the hard day at working at desk, which seems funny, but it is hard work sitting still in the same place. And most importantly, take breaks. Breaks are key, especially working at home. A lot of times at the office, you are sitting there and you have a break because you have to go to the printer. You have to go over to somebody's office. You have to go to the bathroom that's down the hallway, or you have to go and talk to a friend real quick, or a friend catches you. So there's a lot of breaks built into the day. Working from home, there are not a lot of breaks built into the day. You are stuck there. You probably have a cooler now at this point at your desk where you pull out a drink, everything you've drawn your whole entire house within reaching distance of you. So it's less likely that you're going to get up. Plus, you don't have a commute, so there's more time sitting at that desk. And so it's important to understand, okay, I need to force these breaks into my workday. And then you've got the justification of working from home by, like now, having Zoom meetings. So there's a lot of times people are in these meetings all day long, not given a break, and you just don't have that downtime because you're clicking out of one meeting and you're clicking to the other. So it's important to understand, take a break, get up, stretch, and undo everything that you have done during the day. All right, and so this is just a quick look at all of those things transposed onto the picture from the calculator. And this kind of tells you the right optimum position, hips and knees, the proper clearance, feet are grounded on the floor. So this is ideally where we all want to be. And the important quick thing, because we've talked about the others, it's understanding the low back support and what that means and why that's there. Low back support helps to force the hips in a position that your upper body naturally goes into a rested position. So you have that lumbar support, low back support. It can help to take you from a curved position to sitting upright. And so for some people, it's annoying, but when you understand how to use it and how to position it, it actually helps you a lot more because your hips in the right position and your upper body is in a better position. Because proper position doesn't mean pulling your shoulders back. It means positioning your hips, getting under your torso on top of your hips, and your shoulder in that natural resting position. Purchasing, what to buy. It's individual. It's like a mattress. You can't just go onto Amazon and look for the best reviews and purchase that. It is a very individual thing. Everybody's a different height. Everybody's a different size. Everybody's some people have glasses, some people don't. So it's not universal. But the most important three things to look at home are your chair, your keyboard, and I'll add mouse to that, and then desk. Because a small keyboard can position you where your elbows are flared and your wrists are in very awkward positions. Chairs can have you relaxing when you should be sitting up or leaning too far forward, or you're just rolling around in the chair because your feet aren't on the ground. The desk is the second one, is understanding that you don't have to purchase a $300 desk to have your needs met. So what I have here is just a random review. It's 2,800 or 28,000 people have reviewed, and it's 4.8 out of 5 stars. That's great if it's you, if that's the desk chair for you. So whenever you're looking at reviews, yes, there's a lot of good reviews, but the important thing to look at with reviews is where you fit into this part here, which is the 1-star review, the 2-star reviews. Those are the ones that are going to tell you a theme. What are the problems that people are having with it? The themes to look for are, I just don't like the color. I don't like the fabric. I don't like the look. It's too sheen. That's an acceptable risk. Now, if it says it falls apart quickly, or I have pain here, or it solved one problem, but I now have a new problem. You're looking for a theme, and that's the important part about doing your research is, not getting caught up with the 5-star or the high, almost 5-star reviews, is understanding where the issues are and looking for themes, not durable or just anything that feels like, that was the concern, that's why I'm getting it, but actually it turns out it's going to cause and exacerbate those symptoms. So just to wrap that up, all of these things, if you remember anything, is individualize your purchase for you. If you are working from home in a joint space, is recognizing that you might need to accommodate 2 different people with 2 different sets of equipment, or find adjustable equipment to meet the needs of both, because what is good for one may not be good for the other. And so you want to find what fits and feels comfortable. All right, and so we'll open it up to questions, for if anybody has any questions of anything we've discussed, or just questions related specifically to conditions and pain that they're managing through right now.
Well, I just have a statement. My husband actually works from home, and he bought a stand-up desk from IKEA that's adjustable with a little crank. So what he can do, it's nice because that makes it really easy to adjust to his height. And then in the afternoon when his legs get tired, we just bought a tall stool and he rolls that up to the desk so that he gets some variation with standing and sitting because I have a friend who's a chiropractor who said, you know, you shouldn't be standing all day and you shouldn't be sitting all day. You need to vary it and get up and move around. And so he's had a lot of luck with his adjustable stand-up desk, and that's worked for him.
Yeah, and I am a big fan of stand-up desks, especially the adjustable. That is where the ergonomic industry is going to allow people to, whether it's a crank desk, a motorized desk, or a push-button piston-controlled. The stand-up desks are very important to varying that up because either way, gravity is going to grind on you if you're in a sustained position for a long time. And grinding, as many of us know, as we get older, we get shorter, and that is gravity. So understanding how to vary those positions to deflect the price of gravity is important. And you know, when you're thinking of a stand-up desk and a stool, grounding your feet is often missed because if those feet aren't grounded, then you're going to start to change where that
Mm-hmm.
pain and loads. And so short term, great. Long term, think about adding a stool. Or
Good.
sorry, a step, a base to support your feet.
Right. And some stools have that ring around them so that you can put your feet on, which is nice.
Yes. But you have to be mindful of if you have to reach back and you change the angle, you could compress nerves down into the feet because there's nerves at the back of your
Oh,
knees. And so that's why the recommendation is 90 degrees.
oh, good feedback. Thank you. Well, we did get a few questions in advance.
Sure.
So one of them was, can you speak about if someone is having pain, talk a little bit about ice versus heat?
Sure. Uh, there is a lot of debate now in the community about ice for, you know, tennis elbow or golfer's elbow. Typically, it's been when you have an injury, you ice it or use price or rice or any variation of that, you know, rest, ice, compression, elevation. All of those are good when appropriate, but understanding that ice addresses pain and inflammation, and heat softens stiff, tight, and potentially triggered tissues. So if you're warming up for the day, typically you want to use heat, or if you're needing to do an activity outside, you want to warm up with heat. And then after that activity, you want to think of utilizing ice. There are certain situations where you don't have any inflammation, you just have pain from strain. And heat might be beneficial versus using ice after that activity because the work has caused those muscles to tighten up. And so that's when you want to think about maybe I will use some heat. And you just kind of have to individualize it to what feels good and what provides you the most relief. And that is the thing to understand with a lot of these interventions and treatments is they're not universal. There are some clinics where I've worked in where there's a universal platform and they get you in and you put heat on, you do ultrasound, you do a little bit of manual therapy, they put ice on you and you leave. And that's great for the middle part of us, the 50% of us in the middle that would benefit from it. But there's some people that need a little bit more individualized understanding of their conditions and how to better utilize modalities and resting and positioning. Because resting is, you know, how you sleep at night. Resting is how you take breaks at work. Resting is how you take breaks on the weekend.
Great, thank you. Another question we have is if I have an injury, how long does it take to recover? Like, what can I expect a course of therapy treatment? How long would that be?
Typically, for a lot of the repetitive stress injuries, whether it's surgery or just coming in, you're looking at roughly 6 to 8 weeks. What what's unique about the hand clinic here is we're able to see people twice a week and see people through, 6 to 8 weeks, which is important for eliminating pain. The first 2 to 4 weeks, that's the whole goal, is to help eliminate pain, because exercises are great, but eliminating pain is the most important part. And that's where that 2 to 6 weeks comes in. It will not eliminate your problem completely. It's to provide you with the pain relief, the positioning and understanding of the joint mechanics, help begin the strengthening process, but overall just help you decrease the load while providing relief, adding length to those muscles, getting them stretched out. So the next phase, where you're doing home exercises and really modifying your environment, that is the part that is, sort of your responsibility as a patient or somebody in need or in the recovery, is really taking it to, because you don't make habits in 2 to 6 weeks. You don't make habits in 6 to 8 weeks. It's a long-term investment. And so a big focus of what we do here is we do the things that you can't do at home. So in those 6 weeks, 6 to 8 weeks, it is really eliminating the pain and allowing you to do the exercises at home and ensuring that we're not exacerbating any things at work and we're not exacerbating anything in the clinic, so you feel comfortable doing the next phase of your exercises and stretches, and engagement in activities at home.
Thank you. So can you talk just a little bit about the focus of occupational therapy and hand therapy in terms of ADLs?
Yes, so
And explain what those are.
Sure. Typically, the big primary focus of occupational therapy is to help people better engage in everyday life. So ADLs being activities of daily living, and IADLs being instrumental activities of daily living. Difference there being ADLs are the basic activities: dressing, bathing, going to the bathroom. And IADLs are things like paying bills, child rearing, things that
Drinking coffee.
Yes, drinking coffee. All the things that don't involve have tos in your day. I mean, bathing should be a have to. It's not a have to for everybody, but it is an activity of daily living. And so our goal in occupational therapy is to help restore functional performance in those areas, so you can better engage in those activities. And where it differs from a lot of other interventions is we come in and we assess you and your subjective understanding of your level of function. And it's not until you say you're better that we stop. We don't address, like, your measurements could be better, your strength could be better, but until you feel like your participation in all those activities is better. That's the goal of occupational therapy, whether it's helping you learn how to grip milk jug better, or the cup of coffee, glass of water, turning doorknobs, driving, being able to reach and wipe yourself after the bathroom. There's just a lot of things that people don't take in consideration when they have an injury of the upper extremity, how important it is to have that function. And so that's our primary goal. The modalities and the interventions differ on an individual basis, but the bottom line is the same goal: helping restore function and get you to greater independence.
And I'm going to put it in the chat if anyone's interested in taking the next step. Jeff, you said that you were a previous patient for a previous injury. And I know you said you're moving out of town, but for anyone else on the call, if they're interested in engaging and taking the next step, they can go to our website and fill out a form, or they can call us at 425-892-2243. And Kim, can you talk a little bit, one of the questions was also, do I need a referral?
Sure. You do. We unfortunately not in a direct access state. So in order to be seen for therapy, you do need a direct referral. from a doctor. And we are happy to help you get that. So if you need to come in and you need to be seen, we will help navigate that for you so we can make it easy. Because a lot of times you've mentioned that you've had pain or you've had an injury to your primary doctor, or even if you're under care currently, and the doctor, especially given the times, is happy to send that referral over. But we make it easy for you. We'll help you get that referral or point you in the direction and how to get that referral.
Thank you. Um, so does anyone have any additional questions? Well, if not, thank you so much for attending. We're right at 7, and we really appreciate you being here. Thank you for engaging with us. Hope you learned something tonight. And Jeff, good luck to you in your move and your new job. And thanks for being here.
Yeah, thank
Thank
you.
you.